And we are moving, as mentioned already, for the first time, we do have a WSA Young Innovator coming from Chad, and this is Telemedan. He could not join us in Hyderabad because the government was so impressed by his beautiful product that he said, we want to go on a field trip with you. And the impact in the country was more important for him than coming to Hyderabad, which is very laudable, but we cannot wait to hear your story now. Abakar, the floor is yours.
Thank you very much, Nora. Hi, everyone. So I'm going to share my screen. So hi, everyone. I'm Abakar Mohamed from Chad. I'm the founder and the CEO of Telemedan. So let's go. Okay. But before we start, please allow me to take you back in 377 before Christ. The next day after the death of the father of the modern medicine, Hippocrates, when his son, Thessalos, came saw the king to ask him for independence of his father's will. He came to see the king to ask him to recruit more doctors, to put more resources, to recruit more doctors, to train more doctors, because Hippocrates knew what was coming. He saw the danger from growing city and the lack of doctors. Indeed, in Chad, the country I came from, we are 17 million inhabitants for just 2,000 doctors. We are far away from the WHO standards, which recommends 23 doctors for 10,000 inhabitants. In Chad, it's saying like 1 doctor for 8,000 Chadians. And it's not just a Chadian problem, it's an African problem, and also it's a global problem, because more than 2 billion or 3 billion people around the world don't have access to healthcare services. And this is due to the high rate of extreme poverty and the lack of infrastructure. So that's why we had to come with a solution that will bring effectiveness, affordability, and innovation. So we designed and built Telemedan. So what is Telemedan? Telemedan is a medical kiosk that we designed that is powered by solar energy and connected to internet that we deploy in remote areas to allow remote communities to have access to healthcare services with doctors located in Jamena or one another country in Chad, the city. So our value proposition is that, it's affordable because the teleconsultation fees is set at $2 to $5. Before, people had to spend like $50 to $60 just in transportation to come to the city to find a doctor. So now they can have a consultation in their own area for $2 to $5. And also we have the sustainability, because we are using solar energy, because we take in charge that in remote areas there is a low rate of electrification. Just 1% of remote areas are electrified. And we are working also with NGOs to map, to localize the key areas where there is the large amount of medical deserts. Our business model is simple. It's based on grants, impact grants. We are also renting our kiosk, and we are also taking fees from teleconsultations. So our business model is based on these 3 mainstream. So impact to date. For now, we have deployed 37 Telemedan stations and conducted over 250,000 teleconsultation to impact more than 60,000 people. And this is due to our partnership with the Public Ministry of Health and the National Digital Health Program. And in remote communities, we had over 50% of user retention, and also 70% of diminution of out of expense for healthcare services. So for our future projection in the next 2 years, we want to deploy 100 more kiosks, because in Chad, we have 23 provinces and distributed in many districts. So in the next 3 years, our goal is to launch 100 Telemedan kiosks. So we have also an interesting program, which is the SDG 3 Youth Program. So it's a network of over 2,000 young volunteers that are located in each community that we are going. In each province, these these young are helping us to, promote SDG3, promote Telemedan, because, before we move, we have to do campaign awareness to let people know that this is a solution. This is a solution that will help them. They don't need to spend money or to spend time to go to the city for just a teleconsultation. Yeah. So 40% of them are women, 20% of them are refugees from Sudan, because there is the war in Sudan and they're all coming in Chad, and 15% of them are ethnic minorities. So here are some pictures that I got for you to see our work on the field. So our growth plan, like I said, in the 1 year is to expand to 25, and this 3 to 5 year to more. And we are asking for 1 million. We are trying to raise money to do that. And yeah, that's the state growth plan. So our key team member is me. I'm Bakar Mohamed, the founder and the CEO. We have Ahmed Kotoko, which is the Chief Operation Officer. We have Mr. Senusi Ahmad, which is the product manager. We have Bertrand, which is the project manager. We have Gladys, which is administrative assistant. We have also Chanceline, which is our financial manager. We have also Dr. Umayma Jarma, which is she's our advisor boarding. So she helped us. She helped us a lot to to let our solution know among the doctors. So yeah.
Thank you so much. And we have already a first question from Carlos.
Thank you for this. This is inspiring and really fantastic. So I have a question. It's kind of two questions, but they both have to do with funding. So you mentioned at the beginning that that you were funded by grants and that kind of thing. At least that's the impression I came away with from the beginning. But then toward the end, you mentioned that you're trying to raise $1 million. So and I'm wondering, is that also based on grants, or are there other incentives for why people would invest beyond just philanthropy? So that's one part of it, but there's another part that's still very close to this, which is one of the things that's impressed me over the years is that we see these incredible solutions that help to address the issue of healthcare access, everywhere using the internet, using content. And there are tremendous partnership opportunities with corporations that are often underleveraged. When I was at 3M, one of the things I was trying to do was to bring WSA Genius into the company by saying, look at these incredible solutions that people are delivering in countries such as Africa, Latin America, etc., that are getting 1 million people into a database in 6 months or within a year, and delivering, for infant and maternal mortality reduction or whatever, are having a huge impact in terms of the traction they're getting. And what I would say to them, to people, for example, in respiratory and other areas who are concerned with air quality. So we all know air quality is a big issue with impact on public health, and it's only going to get worse. So the thing I would say to them is, here is a venue to raise awareness about air quality among young mothers or whatever, and here's a way to expose your brand to these countries even ahead of your ability to deliver products into those geographies as you're working with their expansion strategies into Africa, into Latin America, etc. And what I was trying to get them to understand was that in a way, this is advertising, but also in a way it's not. In a way, it is delivering social impact through a partnership, through people where the goals are aligned. They want to sell products that help to save lives. You want to deliver a product that helps to save lives. So anyway, I bring this up as an illustration leading to a question. Are you looking at, or have you considered some ways in which other for-profit organizations could leverage your platform as access to be able to find a way to help support and make your initiative more sustainable?
Thank you very much for your question. For questions. So for the first question, yeah, I said grant funding in the beginning, and that we want to raise 1 million. So in the 1 million, it's a bit mixed about impact funding and also equity. So yes, we are now in if accelerator program with Vilgro Africa, they are helping us to refine our business model, to refine our financial model, so we can get ready to our fundraising. So yeah, for example, last year we got a grant from Expo City Dubai Foundation. It was $100,000. So that's a grant. So we were able to deploy more kiosks and to go to the field. And it's a recoverable grant. So we are making profit from it. We can get it back. So yeah, for the 1 million, we are looking for mixed, equity and also impact grant. So for your second question, yeah, we are looking for partner that will, make our impact wider, but it's very difficult, from here, from Chad, for example, we have to look from outside partners because in Chad, we are not that, it's a low middle income country. So we don't have this kind of opportunity yet, but we are trying our best to find, some partner that will help us to widen our impact in the many fields that you mentioned.
Thank you, Abakar. We have a next question from Captain Donald.
Yeah.
Thank you, Nora. Thank you for your solution. I know we've met before online, but my question is, what is the cost of a kiosk? And the second part of the question is, are the materials you use for building the kiosk local, or you do import them? Thank you so much.
Thank you very much, Donald. The kiosk, the cost of one kiosk is $10,000. This is the full price that we sell to the government, to the privates. But the end user, which are the patients, they are just paying teleconsultation fees at the kiosk station. So the price of one kiosk is $10,000. So for the material, yes, we are all building that locally here in Chad, but from some materials we are importing. For example, the ECG analyzer for the cardiac, the screen, all the other stuff, the electronical stuff we are importing. But for the kiosk, the design, the hardware, the software, we are building that here locally in Chad. Yeah.
Thank you. We have a question from Oscar, our winner from Guatemala.
Hello, everyone. Thank you, Nora, and thank you for your pitch. It's a great project. I know you are IoT engineer, right?
Yeah, I'm IT engineer.
Not to be so technically with my question. So it's a beautiful project. And my question are more part of technical. It's, for example, what architecture are you using to connect, for example, your kiosk to your client server connection? For example, you are using edge computer, you are using cloud, and in this case, what is your strategy to ensure the connectivity in the areas with a poor or unstable infrastructure? With a low connection.
Exactly. Thank you very much for a question, Oscar. So yes, in the remote area, like I said at the beginning, for electricity first, it's a huge problem. So that's why we are using solar energy to switch this problem. For the connection also, it's a huge problem. That's why at the beginning we are using cablet internet with RG5 or RG45 cable to limit the bandwidth. But now we are using Starlink because in the most remote areas of Chad, we don't even have the network. So combining solar energy and Starlink, it's perfect. We are connected every time. So we were able to tackle this problem now by 2024. Yeah. But before that, we had some problems, some issues with the connection because some areas are not covered by the network. But now, thanks to Starlink, it's okay. Because you have to know also that they lift the ban of Starlink just last year. It was banished in Chad. So Starlink just got his license last year. So that's why we were able to use it. So now for the connection, Starlink was our solution. So it's okay.
Okay, thank you.
You're welcome.
And we have a question from Ali, our national expert from Iraq.
Thank you, Bakar, for your solution. My question is about supply and demand. You are deploying 100 more stations. That means more demand. But you mentioned in the beginning that Chad has a problem of very little amount of doctors. How would
Yeah.
you solve this? I would think that after 100 stations, the next goal, you would be having less doctors to provide the service.
Yeah. Thank you very much for your question, Ali. So, I mean, for our solution, we are totally conscious that we are not replacing the doctor. We are not there to replace them, but we are there to alleviate the problem and to help them to manage more this stressful situation. So, like I said, in Chad, we are 17 million inhabitants, and the capital, the city, Jamena, we are just 1 million and a half. All other the 80% are located in remote areas, and all those doctors, are located here in Jamena. For the 2,000 doctors, 90% of them are here in Jamena, because of the quality of life, So they are all here. They don't go to provinces. It's very rare. So the demand in province is very, very huge, and 100 kiosks is just a little number. That's just the short-term goal. But to fight against the whole thing, the whole medical disease, it will take more. It will take more. But for the moment, we want to see what 100 more stations will do to alleviate this. Because when we deploy our kiosk, we can witness, the decrease of people coming to city for just a teleconsultation to find a specialist. For example, a dermatologist, a cardiologist, or something like that. They can do it, in their own area. So if they have a complicated case, so now they have to move to come to the city for an operation or something like that. But for the moment, yeah, that's how we are seeing things.
Thank you. We have
I
a
hope
last burning question from Peter.
A lot of the issues, and especially what you do, Abakar, is so important that you go into the rural, non-metropolitan area of Chad, that you are really reaching out, that you're really doing something which is against this concentration of doctors, which we have in many, many countries, and then the rural areas are just underserved. The issue there is, however, is the maintenance of the equipment, the maintenance of basically the support. So that would be my second question. The last question is even more difficult one, is all the kind of things which people, can say or consult with depend on that they have learned already about personal hygiene, that they have learned about personal health issues, that they can tell about what the problems are and how you're dealing with this kind of learning component. The question first was maintenance of equipment. The second one is learning side in order for the consultation to work well.
Yeah. So thank you very much for your question. For the first question, for the maintenance, yeah, actually, every time that we come and install our solution, we deploy, we train local health workers to maintain the kiosk and to be also the intermediary between the kiosk and the patient. Because, also in remote areas, and particularly in Chad, people are not they don't have a literal level of using technology, or, they are not at ease each time. So that's why we choose every time to train at least 2 health workers to maintain and to be the intermediary between the machine and the patient and the doctor. So this is the middleman. So for the maintenance, it's that way. For the hardware, for the software, we can do the maintenance in our office here. It's okay. So it's just with distance. We are updating things, and we are launching to the server. So everything is doing well. So if there is a huge problem, maybe, for example, the screen of the kiosk has been broken or something like that, then we move to the remote areas to change it. We have a contract maintenance with the government when, so that's it. So for the second question, yeah, when the patient come for the first consultation with his doctor, so he gave him a lot of following. For example, the patient can make an exam at the lab and then scan the result through the kiosk to his doctor to receive it in numerical form. So the doctor can see it and resend, for example, an ordinance or a medical billing that the patient again can print via the terminal. So there is a follow-up after the teleconsultation with the local health worker and the distant doctor. So there is always. And now this year we launch our mobile application, which is now available in Android, but not in the Apple Store yet, because we still have some complication. So this mobile application helps the patient to have all his data in his mobile phone, so he can check and he can do his follow-up by himself. And receive also, of course, health tips and every other stuff.
Excellent. Thank you.
Thank you, Abakar. Is there anything the WSA community can support you with?
I mean, you guys are doing great for the moment. We received a lot of support. I just didn't have the opportunity to come to India. Maybe next year, I don't know. For the support, yeah, I mean, just please connect us with like-minded people. It's very important, so we can grow together and still learning, because that's our key force.
Thank you, Abakar.